I'm Erin Dalton with the Department of Human Services. So you've heard there's a state DHS and a local DHS, just to make things more confusing. So the local Department of Human Services is where I work. In many ways, we're on the front lines of providing human services at the county level. I wanted to note that there are folks here from DHS, like the director, who might be more appropriate to speak to some of these issues than me. I say that, Mark's here, I say that to lower expectations appropriately, but also so that you can engage him in this discussion as well. So I think I'll just talk a little bit about the department and the way we do our work to give you some sense of what the local context is, which may differ from other places around the state and around the country. And then I'll raise a couple of questions that I think might help to get this research more embedded in the work that human services departments around the country and communities trying to tackle these issues need to focus on. But I just have to, because it's really exciting to hear at the state level that you're doing people's stat meetings and really focusing on issues. Everyone knows what I'm about to say. Everyone who knows me knows what I'm about to say. So some of that data that resides at the state level really does need to get to the county level. We are in many ways on the front lines, and so one of the areas where we still are lacking data from the state systems is in the early childhood area. And so just a pitch that I can't help but making for getting that data down to the local level so that we can get kids who have these adverse child experiences into early childhood, quality childhood care as early as possible. All right, so the Department of Human Services serves about 200,000 people a year. This is about a fifth of the county population. I think it's fair to say that if we had ACEs scores, we don't have ACEs scores on our clients, but if we did, they are vulnerable populations. They experience elevated risk and adversity in childhood and throughout their current environment, living conditions. So we serve, Mark likes to say, cradle to grave. So from early childhood through child welfare, homeless services, providing mental health and drug and alcohol treatment services, intellectual disability services, aging services, and so on. So we're serving a broad spectrum of the population. I think one of the things that I heard most clearly in many different ways from the presentations earlier today are really to get in there early. It was said directly, and it was said in different ways. And just to talk a little bit about the ways we try to get in there early. So home visiting, nurse-family partnerships, programs of that nature are certainly something that we are investing in with support from local foundations, including the Heinz Endowments. And we've been able to create a coordinated intake for home visiting. So in Allegheny County previously, and in many places around the country, there's not a coordinated process by which to get home visiting. So we don't know if there are slots open, and the most vulnerable populations or most vulnerable families may not be getting those slots since we don't have universal care. So now we have a coordinated intake, and we can help to get the most at-risk population, most needy population to those slots. We also, we run the child welfare system. So any child, any family that's eligible, meets the eligibility criteria for home visiting programs, gets an automatic referral for home visiting, no matter what stage of the child welfare case they're in. So if you're a teenager who's in care and becomes pregnant, you get a referral to the home visiting network. If you're a child who, or a family who has had an allegation of abuse or neglect, and we don't take action on that case, we screen it out at the time of call, you still get a referral to the home visiting network. And that home visiting network is voluntary, so it allows the workforce, our home visiting workers, to make a call to that family and see if they would like to engage in home visiting services. So that's one way that we're trying to bring that service to a set of vulnerable families. As Pastor Greg mentioned, we also have 26 family support centers around the county. This is an investment in parenting, and it's an investment in supporting families. It's an investment that, through external research, we found does prevent child abuse and neglect. We care about early intervention, of course, and support that, and parenting in all kinds of different ways and all kinds of different investments. We also even have the ability to care about and understand attendance, especially at early ages. So We have data sharing agreements with local school districts. We have partnerships with them so that we can understand when a kindergartner is missing a month of school. Those are also, it seems to be critical or sensitive times when missing that amount of education will affect them over the long term. Return to child welfare for a second. So I think it's worth noting a couple of things. So one, the number of kids in out-of-home care has been reduced greatly over the past 20 years. There were 3,500 or so kids in care at one point, and now we have 1,200 or so kids in care. Still too many, it's still going down. Most of those kids that are in care are in foster situations, they're not in group care, and 60% of those are with kin, right? So most of our families stay intact. Most of our families stay intact, period. Most of the people we're serving, when we have to make a home removal, they're with kin. And that's the situation that we think is best supportive of families. However, it does create this challenge that of the multiple generations of trauma, and how do we support those kids in getting better, and those parents and those grandparents in getting better through multiple generation, 2-generation, 3-generation approaches. Let's see, so I should mention, we do, because I'm the data person, so I should mention something about data. If we're thinking about how do we get there early, how do we use the data to do that? So I think some folks in the room are aware that we are using some predictive risk modeling to help inform child welfare decision making. We can also use this kind of modeling to help prevent child abuse and neglect. We have not implemented this yet. We're still talking about this with the community, but we have the modeling to understand at birth the likelihood of a child welfare case open, say by the time the child is 3. That's really just a proxy for lots of other things. We could probably change that outcome to kindergarten readiness by age 5, to help us to identify families who have had those sort of adverse experiences. And so we could use that data to move up prevention, to bring home visiting at the time of birth, not wait till a pediatrician makes a call, or not wait until the family comes to our attention in another way. So that's something that we're, I think, excited about and talking actively about. All right, so the sort of 4 questions are, 1, so how do you set up from a policy context? How do you set up the context where you can invest early? I think Allegheny County is probably a bit of an anomaly in being able to, or Mark taking risks in order to spend a great deal of dollars on prevention over intervention. So even in the case of child welfare, when we make home removals, we don't do so immediately. Over 95% of cases, there's an in-home service, like Pastor Greg talked about first. So we're preventing whenever we can, spending our resources there, and even when we're intervening, they're through things that are less invasive, if you will. So how do you set up the parameters for investing early? So some of that's about knowledge, right? If folks don't know that you need to be investing early, that those kind of prevention is more effective, then they're not going to know to invest in it. But I think another big issue is the way the funding is structured in order to invest early. So, up until recently, and it may be like this in the future, in Allegheny County, every time we would remove a child from the home, we lost money, right? So, or we decided not to remove a child from the home, we lost money. So when we remove children from the home, we are able to draw down federal dollars. If you don't remove children from the home, you can't draw down those federal dollars. That's not what I think you would want us to do. I think you would want us to invest those dollars in prevention, in supportive services. So how do you ensure that the funding mechanisms are available to policymakers in order to support intervening early? I think another question that wasn't really discussed here today, but I think about sometimes is, what is early? So we've really been talking about from birth here, but I think really it's getting at moms before they become pregnant and trying to understand the risk factors at that point. Some of the work that RK Mellon is investing in predicting infant mortality and predicting newborn distress, or it's probably not the right word, but I think gets to how do we engage those parents before they have kids. And I think this is an area where you can take the data directly to those soon-to-be moms and help them to understand their risk factors and reach out for support. A newly pregnant mom is a good, really wants to do the best for her child, and so it's an opportunity to work with them then. I think we probably do need more help in translating this research into interventions that work when we want to keep families intact. So we're aware of two-generation approaches. I don't think we're at a place where we know quite how to implement them in the best way. So I think we do need help in models that work to support both parents and children to stay together and to recover. And then the last thing I wanted to mention, which is off topic for today, but I think is a challenge and maybe a topic for a different day, is the workforce issue. So who are serving families on the front lines and how are they supported? They're making decisions under risk and under stress, and how can we help them to make those best decisions? I think there's also a high likelihood like the story that you heard before, that people who have experienced a lot of trauma, as they recover, they go back into helping professions. And so they're recovering themselves, and they're dealing with families in various places of recovery. And they may or may not understand how behavior of those families is really a symptom of trauma and not a symptom of something else. So I think supporting those peers who we have working in the field, supporting judges who have to make really challenging decisions, who may or may not understand the effects of trauma, and supporting our workers.